Good morning. It is so great to be with you again. I hope your Saturday is off to a great start. You jumped out of bed this morning just all fired up and ready to go with all the busy stuff I know you have to do on your weekends. And if that is you, if that's how you started your day, my guess is you probably don't have a thyroid disorder, because people with thyroid disorders often, well, they kind of feel just sort of lousy. And especially if it's untreated, you're in a situation where you might have fatigue, you're trouble regulating your body temperature, you might have, constipation issues, uncontrolled weight gain. There are a lot of different symptoms that come along with having that thyroid gland that's out of control. So that is our focus today, talking with Gregg Russell, founder of Fort Wayne Custom RX, also a clinical nutritionist. Greg, thank you for joining us.
Great to be here.
So tell me about, you've treated people with thyroid for 20 plus years, and I know you do some custom compounding to help them get just the right mixture of things. We're going to talk about all of that, but walk me through the symptoms and what people need to be looking for if they have an undiagnosed thyroid problem.
Well, sure. Probably the overwhelming number one thing, people will say, man, I just feel older than my age. I'm just exhausted. My skin's dry. Bowel habits have slowed. They feel more bloated. So then, you cross over, is that something else? There's just a massive symptom. So probably the two things I see people come in and say to me, or three things I would say, they're going to say, I feel cold in the morning, which may or may not be a sign of low thyroid, or I feel so exhausted, I barely can get out of bed, and I kind of feel that way all day. And then finally, especially for my female listeners, it's I'm losing hair. Now, there's a lot of things that can cause hair loss. So, basically the endocrinologists say to us, they say people at age 35 should start getting their thyroid checked probably every 5 years, because this is a huge problem. 11 million Americans suffer from this.
And women more than men?
Women more than men. There is an autoimmune component to this disorder.
So I'm going to take a stab at this, and you correct me if I get anything wrong. This is a very complex chain. So my understanding of things is you've got a couple little glands in your brain, the hypothalamus and the pituitary gland, and they're monitoring a lot of different activities in your body, and they reach out to the thyroid and say, hey, dude, get to work. We need some help here. We need some thyroid hormone for the rest of the body.
Right.
And then that's where things can start to go wrong.
Exactly. So fortunately, if you go to an endocrinologist, they can measure the different hormones that are secreted by these glands. Thank goodness the hypothalamus very, very rarely causes a problem, because the hypothalamus is the master gland, and it regulates not only the thyroid gland, but the adrenal glands, the pancreas, the ovaries and the testes, and it's just involved in that whole process. The pituitary also is a secondary gland that helps regulate these things, but the pituitary sends a signal to the thyroid gland in the form of a hormone called thyroid stimulating hormone. Or obviously people get a test done. It's called the TSH test, and it's an inverse test. In other words, if the pituitary is telling the thyroid to secrete, if the pituitary sends the signal, the TSH, to the thyroid gland and secretes it in large amounts, it's because for whatever reason there's a signal to that gland that says, hey, I need to make more thyroid hormone. So there are two thyroid hormones. There's T4 and T3, and that's where sometimes where a lot of the confusion starts to occur in the medical community.
Yeah, it's complex. So we're taking the TSH is typically telling it to produce T4.
Right.
Which is great, except your body can't really use T4. It has to turn it into T3, and that's where things can get all fouled up.
It is very, very complex. TSH is where I see some of the failure in the medical community is they just measure this TSH. Well, TSH only gives you kind of a glimpse. It doesn't tell you enough data. And today, in the medical community, T4 is the hormone that's replaced, which goes commonly, the generic name is levothyroxine, and the brand name is Synthroid, for example. Well, for maybe 75% of the patients, T4 is enough because they can convert T3. But what happens if you have a patient that can't convert that T4 to T3? And that's where we start seeing problems.
So you're giving them the T4, or their body's making T4, but it's just not getting the job done because it can't go to the active component. What are some of the things? There's some lifestyle issues that are going to keep me from converting T3 effectively.
Sure. So if you remember, we talked last month about detoxification. Okay. So when you have a system where you're inflamed or your liver's not, a lot of conversion of T4 to T3 occurs in the liver. So if you're having a problem, your liver's sluggish, per se, then you're going to have a problem with T4, T3. If you're in a stressed out state, highly anxious personality, or then you have another hormone called cortisol, which I always say is the bully on the block. Cortisol stops all the other hormones from doing their jobs, and so T4 can't convert to T3 in people that are chronically stressed out. And things like obesity, PCOS, polycystic ovary syndrome, insulin resistance, all these things play into the interfering with the T4 to T3 conversion.
So you're making enough T4, but your body just can't put it into a form that it really needs to help address all those symptoms you're feeling.
So there is some T3 that's available commercially. However, it's only available in a few strengths, and it tends to wear off fairly quickly. So people tend to have to dose it 2 or 3 times a day. But and so for that reason, it's not used a lot. And doctors like to give the T4 because they give it once a day, and they pray that it converts to T3. And again, for many patients, if you measure all the hormones, not just TSH, T4, T3, if you measure TSH, T4, and T3, if you measure those and some other forms of thyroid, then we can get a better picture as to whether you're one of those people that are having problems taking that T4 and converting it to T3.
Now, one of the things that you do at Custom RX, the name of your pharmacy, Custom, indicates that you're making medication specifically for people. You do some compounding to try and change those ratios, right, and give a little more T3 if I'm one of those people who can't produce it naturally.
Exactly. So we have to work closely with physicians on that, and we usually get a little bit more thyroid lab tests than what the standard physician's looking at. So we're going to look at total T4, free T4, total T3, free T3, and a TSH. And we might even look at antibodies.
So it's important if I'm taking thyroid meds and I just don't feel like it's working correctly, I need to know, am I converting to T3 well enough? And tell me about the role that you play in interacting and giving feedback to the doctor, because I know that I can come and talk to you and describe symptoms, and I'm going to have a lot more access to my pharmacist than I am my physician.
Right. So we work probably with about a dozen doctors, I'm going to guess, that constantly send us orders. And basically what they'll do is they'll send us the labs. We'll come up with a formulation, send it back to the doctor for his approval. Talk to the patient, explain what we're doing, fill the prescription, and then the patients typically, what we recommend is in about 3 months, recheck your thyroid levels, see if we're close, because again, it's going to be somewhat of a process. It's not a fast overnight thing to fix thyroid. It's usually a 3 to 6 month process. And if you think about it, we want to go low. We start slow and go low, start slow, as we say, because we don't want to give somebody too much thyroid, because the opposite could occur. We could make somebody insomniac, jittery, have their blood pressure shoot through the roof, all those things that we don't want to have happen. So we start slow.
There is a nutritional component to all of this. There are vitamins and minerals that we need to help aid that T3 conversion, and we're going to talk about that in just a moment, what you can do, the foods you need to eat, some supplements you might want to take, all of that as we discuss the mystery of the thyroid gland, and are you feeling lousy because your thyroid's just not up to the job? And we'll get to all of that as we continue here on the Health Call Radio Hour. And back to our conversation with pharmacist and nutritionist Gregg Russell about thyroid management, because it is a huge problem. We mentioned a moment ago that one of the things that you do after all your years of experience is help custom blend T4, T3 ratios for patients. We have listeners all over the country. If I am in a market where I can't really get to you, who do I talk to? How do I find somebody who can do what you do?
Well, thank goodness for the internet, right? So, a couple things you want to look for a compounding pharmacy in your area. Find somebody who's, doing compounded thyroid, and look to see if they're accredited. And what I mean by that is there some kind of accrediting agency out there that's done some accreditation for them. So I like PCAB, PCAB, or ACHC, because what that tells you is that pharmacy has at least gone through an accreditation process. They're living up to the standards of what we believe in the compounding industry are the most important standards for patient safety and of course, coming up with a good product.
So speaking of nutrition as an important element in all of this, we have to eat well, and you can try as hard as you want, but man, there are some things that are just not easy to come by. And so you have a product that you like, and in fact you had it custom blended for you. It's called Thyroid Support with Zinc. Now talk me through this and why this is important.
Yeah, so what I like about this product is, it's going to give us those important minerals and vitamins that are important for that T4 to T3 conversion. And as we kind of start talking about it, I just kind of break down a couple of hormones, what they're made up of. So T4 is basically made of a iodine and a amino acid called tyrosine, and T4 means there's 4 iodines on the tyrosine model, and T3 means there's 3 iodines on the tyrosine molecule. So starting with just your raw ingredients, you got to make sure you have at least a little bit of iodine, a little bit of tyrosine. And so the body, typically, most people don't have a real hard time getting tyrosine. It's an amino acid. It's found in meat and dairy and cheese. However, if you're a strict vegetarian and, or let's say you're a bodybuilder, because tyrosine is used a lot in building muscle, you might get a little bit low on tyrosine. So the supplement contains a little tyrosine in there just to make sure we're covering the basis. The RDA on tyrosine is about 1 gram a day. And this has 500 milligrams, so about half that.
Okay.
Iodine is the other component. Iodine, you get it close to fish, saltwater fish. We live in the Midwest. How much iodine do you suppose we see in our soil?
Yeah, probably not a lot.
Not a lot.
And as more people convert over to sea salt in their seasoning and their cooking, they're missing out on the iodized salt. Is how where most of us get our iodine.
Right, and then you take a look at people on salt-restricted diets, and not that I am trying to get rid of the salt-restricted diet. We got to keep your blood pressure under control. Yep. But we got to start thinking a little bit. I think kelp is a good food source of iodine too. So so vegetarians can get it through kelp. But again, a little bit of iodine is in this product, 150 micrograms, which again we usually say up to 1,000 milligrams of iodine is probably okay to get a day. So between 150 and 300 micrograms.
There's another mineral here that I don't think people really are tracking very closely. People have heard of magnesium and they follow that, but selenium.
Selenium is huge, and this kind of goes back again to our detox talk. Selenium is going to be used to help your body detoxify also. So let's say you're in a crazy state of detoxification and where you're constantly being exposed to pesticides or chemicals, your body is going to use a lot of selenium in there because it's got to take care of that too, and so it's not available then to help. Selenium drives that T4 to T3 process. It helps, it links up with certain enzymes that do that work. So if you don't have enough selenium, you're gonna see that. And again, the Midwest tends to be very low in selenium in the soil.
Sure, and so if I am feeling like I might have a thyroid problem, if I were to take some of this thyroid support with zinc for a period of time and I improve, is that an indication that maybe I really do have a thyroid problem?
It could be. So the other thing that's in there is 4 herbs. You have bacopa, gul, ashwagandha, and I forgot the last one.
Bacopa.
Gugolipid.
Okay.
So those all help in that T4 to T3 conversion. So again, they're not heavy, so that they're going to cause side effects, because with herbs, we always tell people you have to be cautious with herbs because they act kind of like drugs if you take enough of them.
Sure.
So, but these are gentle and in this formulation, as well as it's got some other vitamins. So I love this product because it's pretty easy to take. Take 2 capsules a day.
And if I'm already taking a thyroid med, is this going to put me over? Is there going to be any risk here?
Yeah, in the short term, no. In the long term, what you might find is that your thyroid improves enough that the doctor might want to start reducing your medication. So
that's a win.
Yeah. So, but so we don't want to overdose anybody, right? So,
right.
But we always tell people that are taking thyroid, they really need to get their thyroid levels checked every 6 months to a year, just depending on how stable they are.
And make sure you're looking at that T3 level as well.
Exactly.
Okay. So we've talked a lot about hypothyroid, which is where your thyroid just isn't really doing the job. It's underperforming. There's the other side of that, which is too much thyroid activity. What does that look like?
So it's going to have the exact opposite symptoms. They tend to be people tend to have difficulty sleeping. They tend to sweat more. The heart races. They're more nervous. They can have diarrhea. They still can lose hair, which is what is why we have to always test levels of thyroid, because if you say I'm losing hair, you got to look at what's going on. So they tend to be the opposite. Thank goodness we see a lot more hypothyroidism than we do hyperthyroidism, unless you're a cat. Cats tend to run a lot of hyperthyroidism.
Interesting.
In the animal world. So, that's why hyperthyroidism is people are going to get to the doctor pretty quick. So they're going to feel poorly. Again, the doctor will measure the thyroid levels, and they might do an ultrasound of the thyroid gland, look to see if there's nodules, something that's causing that thyroid to secrete more hormone.
Okay. So, and the onset of these problems typically is, you said, in the 30s to 40s, so fairly young.
Yeah, and, again, there's this whole debate about what they call subclinical hypothyroidism. It means that the levels maybe aren't optimal, but you're not enough to say, hey, you are definitely have hypothyroidism. But, however, your body is starting to get out of balance. I always tell people it's like a three-legged wheel, a three-legged stand. If your thyroid's a little wobbly, then your adrenal glands are going to be a little wobbly. Your blood sugar is going to be a little wobbly, and so it's best for us to really address all of them in your lifestyle.
Yeah, and that lifestyle should include what? What am I need to be doing?
I always tell people that most important things you can do for yourself is eat well.
Well, of course.
Right? Yeah. The most important thing is eat well, and that means eating non-processed foods. Getting your fruits, your vegetables, your lean meats, going to more seafood, like salmon, just being more cognizant of what you eat. Avoid those sugary processed foods.
Let me just jump in for a second on that one, because I got to tell you, out of the hundreds of episodes and all the experts that I've talked to doing this program, I am more convinced than ever that what you put in your mouth is the single most important determinant of your health. Your hereditary factors, all those other things step aside. If you don't feed yourself well, that's where it all tends to start. So I'm going to back you up on that one. So what's the trigger? What's the trigger that I need to be looking at this? If my doctor isn't checking it, what do I really need to say? Hey, doc, let's explore this.
Yeah. So the good news is you can get a full thyroid panel at any lab, and it doesn't require a prescription. Now, you want to involve your doctor, right? Because you want him to help you make the decisions. And the more information you get, the better informed the decision. I think a lot of doctors are just taught that you look at TSH and T4 levels. And Dr. Sorg, an endocrinologist out of Fort Wayne, wrote an article back probably 5 years ago about how the TSH can really fool you. And he was an endocrinologist, and he explained it very eloquently and wrote it in the Fort Wayne Medical Journal. And but it's still, I think most doctors just don't have time to do that deep analysis on that. Yeah. But it takes a lot of work and patience to get people's thyroid under control.
We got to leave it there. That is Gregg Russell. He is the founder of Fort Wayne Custom RX. You'll find them online at fwcustomrx.com, and the product we discussed is thyroid support with zinc. And you can find Gregg and Fort Wayne Custom RX at 425 East DuPont Road. My thanks as always, Gregg.
Thank you.
We'll be back with more of the Health Call Radio Hour right here on Whoa Whoa. Hope you'll stay tuned, and you can visit our website at healthcall.live. You can watch video versions of the interview there, and also drop your email there. You can join our mailing list, and I'll send you one email per week, kind of an outline of what's coming up on the Saturday and the weekend program. So hope you will do exactly that. We'll see you just on the other side of the half hour.